Hello everyone, I am on a special mission today. Bart de Witte came to Ljubljana, Slovenia, and I'm gonna pick him up at the airport. Come with me. So you at the event tomorrow, what are you gonna be talking about?
Of course, agentic AI and the need for operating systems. So, sharing a bit our experience in our work.
In your bags. Okay.
There.
We are.
This is like there used to be this taxi dating stuff.
Yeah,
And then,
in the
people-
US,
in
the
the US.
famous people. So
Yeah.
now you can feel famous, right?
Well, you are famous. I'm
You
not.
are famous.
No, you are.
Neither of us is famous.
But we're famous in our bubble.
Yeah.
Because we probably are one of the endurance people that try to change healthcare and
Don't
still
give up.
believe in that we can change a bit.
Yeah. So I am taking you to your next meeting, and we're gonna take the opportunity of this drive to chat a little bit about AI and agentic AI and stuff. So tell me, people know you for Hippo AI and advocating for open source AI. What's happening with that? You went to, I don't want to say the dark side, but now you have your own company. So in 30 seconds, what does Azyr do? Go, 30 seconds.
Well, 30 seconds. With this array, we're building an operating system that's kind of like we're building a helper that is on your phone. And we don't believe in big AIs. We believe that these helpers should have other helpers, which are then the agents. And so we're building a system that helps physicians or nurses to make better informed decisions or to automate a lot of the administrative processes. And in order to do so, we also build an open ecosystem where people can build together, and we have a marketplace where then people can consume these innovations.
Right. And I saw the short video that I don't think is public yet about the operating system that you're building with AI, because agents are coming into AI and we need to figure out how to manage them. So tell me a little bit more about, like, why did you decide to work on an operating system? What kind of challenges do you anticipate with the rise of AI agents in healthcare?
Yeah, so let's perhaps first define what is an agent in that sense, because everybody was last year talking about GenAI, and now this year everybody's talking about agents, especially now we have that cloud bot and the whole hype around it. But agents have the word agency in that, so they are autonomous and they are goal-driven. They can follow certain tasks and they are self-reflective. But as they have agency and can also do tool calls, like you can call an EMR system to look for information. Of course, there are a lot of security risks involved with it. Like agents can also memorize the data that they are in touch with. They can also leak the data. Agents can be hacked by others in order to collect all the data. So what you will need is, first of all, is a security framework that allows you to do audit trails, but also control access of which tools are they allowed to access. So on the security side, there is a lot of challenges where we see that an operating system that is designed for compliance and designed for trust, where we can then give a platform for all these people that want to build agents, a place to build. The second thing what is extremely challenging is, of course, data privacy, which is related to the security issues. But as we know, a lot of the agents that are built today are actually kind of wrappers around an API of these big AI companies. And we decided to not build a wrapper. We decided to focus on decentralization. So we are bringing these agents directly on the phone or on your iPad or your desktop client, because if the agent processes your sensitive patient data on your device, we are GDPR compliant, but just by design, because we are already processing that. And people didn't believe me last year. It's like, that doesn't work and it's not stable. But then I asked the question, did you believe 20 years ago when you were renting DVDs or Blu-ray discs that in today's world you could watch 50 hours of HD videos offline on your phone? Probably nobody would have expected that. Or listen 100 hours to a podcast from Tjasa, for example, offline on your phone. You couldn't believe that this was possible. And that means that we were able to compress and make these, compress the algorithms or the content. And I see AI in a similar way, that AI is a compression algorithm for actionable knowledge. So we see this now happening, like we can do transcription on device, we can run agents on device, and it's extremely cool because you can do this in a non-surveilled environment, completely private, without having to pay the inference cost or token price for the APIs. So we're building in the very opposite way as most people are doing.
And so before you mentioned quite a few challenges related to privacy and how AI agents are built. Are you seeing anything that maybe healthcare providers are not aware of as just yet when they're thinking about agentic AI? I still think that in many cases we're still talking about basic digital transformations and the introduction of EHRs. So it's not like I don't personally see agentic AI being widely adopted just yet. But the development is definitely there. So I don't know to which extent, healthcare providers, what can they think about at this point in time when they're still kind of trying to figure out what's on the market?
I think being over 25 years now in the health tech industry, these AI agents are the first technology I see that in a very short time can deliver quite a lot of return in investment or value in that sense. So there is quite some adoption that we see of people applying these agents, for example, to pick up the phone and scheduling automatically. These are very low-hanging fruits where these agents can talk to patients and can schedule an appointment. We see agents that are doing triage. We see agents doing administration. But you're correct. A lot of the current health providers, they are still stuck with the EHRs or EMRs, and the biggest challenge is that most of these systems are not designed for what is coming. Like a monolithic application, just like the Epics of this world, I just name it. Like they all are similar, but Epic is the most prominent. These are monolithic applications that are not designed for agentic AI or for agentic workflows. For the fact that the business logic of these applications is embedded within the code. The data is proprietary. I think agentic AI will lead to a need for data standardization, similar to openEHR or openEHR. I want to speak about it. But what you will see is that the providers that are switching away from classic monolithic EHRs or EMRs and switch to data platforms, such as the ones that the openEHR community has been building over the last 20 years, that these companies or organizations that have been focusing on building a solid data platform foundation, they will be able to profit most. So if you think about creating agentic workflows and starting to automate, and you didn't do the investments in building a solid data infrastructure, you most probably will fail to get all the value out of these agents. So there will be a need, and you see it already happening. Karolinska decided to go to openEHR in Europe. Catalonia is going through that whole transformation based on openEHR. You see a lot of these larger providers now switching to openEHR-based data platforms, and they do this because, of course, they are preparing for what is coming, and that's the age of AI that you need standardized data.
Yeah, but do you really think that Epic is not going to build AI agents? I think the whole market was shocked in a way last August when Epic unveiled several ambient solutions, which kind of was not a great with Epic. So it wasn't a great news for those that are doing ambient solutions and are integrating into Epic.
I've been a product manager myself for SAP Cloud Solutions. I just know the challenge Epic has. Their architecture is not a modern architecture. Yes, they can embed a scribe, but a scribe is not an agentic workflow. A scribe is just listening to the environment and automatically documenting. That's kind of replacing the keyboard and then automating documentation. But what you will see happening is when you start connecting these agents, and that's what we allow in our operating system, to create what we then call these agentic workflows that are sometimes touching on different systems and not always is Epic. So you need something that is crossing all applications and even organizations in order to create automated workflows. And you will never be able to do that within Epic. Of course, Epic will always claim we are the ones that are hosting the workflow. But I think as these other clients with the data platforms and as our operating system and perhaps others as well, will give way more flexibility in how to consume agents. You can have the choice of which agent you want to introduce. You're not obliged to take the Epic agent, but you have a variety of agents that you can connect to each other based on open standards. That you will see these companies that are embracing these open platforms will have much faster implementations for lower cost and have way more agility as these larger monolithic sites. And secondly, I also don't believe that in the future these classical UIs, dashboards and everything, what is the interaction with Epic, will be the future of interaction. The future of interaction is conversational. And Epic doesn't do that, or it will always be very cost incentive for them to transform them. Or they go to a whole technical transformation, which would be extremely costly. And I know this from SAP, we did it as well when we moved to in-memory databases to SAP HANA. All our clients were just occupied by switching the core technology from SAP systems to something new and didn't gain any additional function. So I think all these clients that are using Epic, they will be challenged if Epic does a transformation. So I don't think these solutions are the future.
Okay. One of the things that you mentioned in the video for Azyr is also that the solutions can now be very configurable. People can build their own agents. Clinicians can build their own agents based on their needs. And I wonder, what are clinicians going to be required to do in the future? Is this going to be just an additional burden to now also have to build your own agents? So how do you see that?
I don't think that we're going to oblige every physician to build it. We are moving towards a marketplace. It's similar to Android and a Play Store. You don't have to build all your apps on your Android phone in order to be able to consume apps. We will have validated and certified regulatory compliant agents that can be consumed on a marketplace. But in order to get there, we need to build communities. So we started to build a community hub with tools that allow these clinicians to build their own agents. And I give you a very cool example. 2 weeks ago, I was in a call with a German company that does micro supplementations in nutrition. They are like a very high-end company. And they work together with physicians, and they educate these clinicians and physicians to how to prescribe, these are not prescription supplementations, but how to use their products. And they have 180 people doing nothing else as going to these physicians, going to the clinicians and learn them how to use these products. And within that call, I built an agent in 10 minutes. I downloaded the agent on my phone. I created a patient case. I asked the agent which products should be recommended, and I got the correct answers, and I've built this in 15 minutes. The guy was actually speechless that something like that was possible. It was a lucky punch because I didn't fine-tune the model, we did any rack implementations, but it showed kind of the power. And last week I heard a podcast which was quite insightful, with somebody who's now building, we have the same thing with coding now, everybody can prompt software. Like, what is going to happen? And he mentioned that in the past you had 500,000 of a few million of coders that were actually coding software. And now you have 2 billion.
Yeah.
So the tools are changing, and that means that it doesn't need that we're gonna oblige every clinician to start programming and learn Python and learn how to train and fine-tune these models, but we will see tools that allow him to get more flexibility in order to build. And that ecosystem can also be suppliers of medtech devices, or this can be companies that are independent software vendors that use our platform. This can be totally open.
My husband actually was mentioning last week a trend, because it's so easy to build apps nowadays, that we're moving into the one user per app era. So what do you think about that? Like, what does that translate into healthcare? How does that translate into healthcare?
Well, I don't think you can do partly yes, because sometimes I know that physicians today, they have their Excel sheets and they do the calculations and they use their own tools. They like standardization, but in a lot of cases they also like to still do research and with their patients. So giving the possibility to build tools. But as I said, like, as soon as you have n equaling 2, you will need to go to validation, you will need to go to certification, you will need to talk about liabilities and all these things, and that's going to be a very different game. And in what you said, we already doing this, like we had in our Azyr companies started to try to cut your costs as much as possible, and we were using a few tools that costed us like 50 euros a month. And we vibe coded all of these tools, and now we are using this for ourselves. Nobody else has access, but it was exactly the same as what we paid for, and it's for free. So we already living that, because we want, as a startup as well, be an AI first company and deploy these technologies internally as well for us.
So is it, who are your competitors?
That's a good question. There is nobody actually doing that in the way we are doing it, but there are, of course, marketplaces for agents.
Careful, Bart. Careful.
I know.
You say you don't have competition.
No. I didn't say that. I didn't say that.
You know how that is.
I know. There is, like, for example, in the US, Hippocratic AI, but it's a closed system. They built their agents themselves. They also have an agent marketplace. There is Commure in the US, also something that is an agentic platform with agents, also closed. There is then a company called openEHR that just went through the roof with their 11 billion valuation, that work together with research publishers like JAMA, and they create an AI assistant in the US. Then in Europe, you would have HealthSage in Holland, which is a more open platform, but they have a different, Quadrivia, but I haven't seen anybody doing that open approach, because a lot of people are very scared about how do you regulate an open approach, how you deal with it. But you know me, I've been pushing the open agenda for 7 years. And what we have seen now with Hugging Face, which was a platform for open source AI models, that which is now valuated at 6 billion as well, that these platforms do work. And in the Hugging Face environment, there are, I think, like there's 60,000 models being uploaded on a daily basis, and they create these network effects. So that open approach allows us to build community, to create these network effects, to create local content. And that's what I said, I haven't seen anybody doing that open approach. But of course, there are many out there playing in the agentic space. There is in Austria a company called Healthforce. They are building agents that are a black box, and you put them in your hospital. They do one certain task, but it's a black box. They sell it for, like, for example, 80,000 claims a month, or like on a usage price basis. So many are in that space, but everybody's still searching for what is the best model that scales best, I think. So I didn't want to say we don't have competition, but if you're really precise in terms of the model, I don't see a lot of touching that open community model that we are pushing.
So if you have the open community model, what's the business model? How are you gonna survive and fund your development? And what trends do you see in business models because of agentic AI? I guess one of the big changes in software in the last 10 years is that now everything is software as a service. You need a subscription for everything. Even as a hospital, you can't just do an upfront investment and then pay for updates and for services to the software companies.
Yeah, so we also we have different ways of monetization in the earliest phases. Currently, our projects are based on consultancy fees because we're building together with hospitals. But we are going to have a premium model where the assistant has premium functions such as the improvement on context management, the long-term memorization. The freemium model, because you can run these agents on the phone, gives you a lot of utility, but it's limited. So we're gonna extend that with a premium fee for the individual users. For the hospitals, it's similar. We can have the agentic hub where people can build agents. If you want to close your innovations that only your employees in your hospital can access these agents, you will need to pay a subscription fee as well, which is then allowing you to not make your agents visible to all the others in the community. It's similar to GitHub. In GitHub, you have the same model where you have a free GitHub account if you open source all your stuff, but if you want to have a private repository, you have to pay. And then we're going to evolve to, once these agents are validated and certified, we're going to evolve to a marketplace model where we take commission on these agents developed by others, similar to Android or the App Store from Apple.
Sounds like a plan.
Yes, that's definitely a plan. We did a lot of interviews, and one of the things, the challenge that we have in Europe is that there is a really bad transfer rate from public research to clinical deployment and integrating in the clinical workflow. And one of the value propositions that when we pitch to investors, is we want to actually shorten the time from innovation to deployment. I think in Europe, the transfer rate is in public research is in Germany. It is between 6 and 8%. That is not a lot. In other countries, in France, it's 10 to 12%. And when you look at the global patents for innovations, Europe in the GenAI space is 2% of the world patents. So we have been doing a really bad job in translating our research and putting that into the clinical workflow. And I think with what we are building, we want to actually accelerate it. So if I can, during a call, build an agent and deploy it in 15 minutes into a clinical workflow for just a demo, then everybody should be already aware that this is a game changer, because we can accelerate and shorten the innovation space with the deployment space. And I think that's where we want to cooperate with research institutes, with university hospitals, where they start deploying these innovations on our platform.
How do you think these solutions, if this is the trend that's going to happen, how is all this going to be regulated?
Well, the regulations, as you know, there is the AI Act, which is and the MDR regulations, which is now under revision according to the Omnibus. I don't know if you ever heard of the Omnibus from the European Union.
Yeah.
So the Omnibus is a project that tries to simplify regulations and tries to eliminate contradictions and overlaps between regulations. But what is very clear is that these general purpose AI models from the large big AI companies are never going to become a medical product because they are general purpose. If you want to certify an agent, you're going to have to be very specific on what that agent does, and you cannot create a general purpose agent and clinically validate and certify that. So my assumption, and a lot of people are confirming this as well, that are experts in that space. I'm not an expert, I'm well read, but I'm definitely not an expert. So like the future is going to be about highly specialized models where we have the data cards, we have transparency on the training data, we have the model cards, and then certifications on an agentic level that that agent is certified for doing that specific task. And that means that we will see a variety on a lot of small agents based on small language models or other different technologies. And now the neat thing that comes is that last year we saw the first papers describing when you then bring these small specialized agents together, together trying to diagnose a patient case. And there was one paper that was focusing on rare diseases where they had 54 specialized agents based on llama models, 7 billion parameter models. So one agent was a nephrologist, the other was a cardiologist, the other was an oncologist. Every agent had a specialization. When you orchestrate them, they overperformed, and not minimal, they overperformed with a double-digit accuracy level on the big AI models. So, and that is very promising because that means that we can control these agents through certification and validation. And then when we orchestrate them in what we call swarm intelligence networks, we have a system that is more sustainable as the big AI companies because it uses way less energy. It is more diverse because you can plug and play agents that are trained on your local population data. So if you would be deploying Azyr in Africa, you could then use local agents trained on your local data, and they overperform. And I think that is what we will see, that these swarm intelligent layers where agents start to collaborate, and I'm not talking about Moldbook now, the hype thing about the mold agents who have their own Facebook now, but we allow them to collaborate, that the intelligence combined together is going to overperform on these large systems. And that is a very promising message for Europe, because that would mean that we don't need these super large models, we need small models that are very good in a certain speciality, and we need really good orchestrators and an operating system.
That's good. I like a positive message, especially for Europe.
Yeah, no, it is that's what we need to aim for. I think China is working on systems that are controlled by the government, but they're doing open source because you mentioned my Hippo Eye Foundation. I was 7 years advocating for Europe that they should lead open source. I think I spoke Chinese and the Chinese understood me, but the Europeans didn't. And now the US is going about, as always, big corporate platforms. And Europe should go into decentralization because it fits so well to our culture where everybody in Europe could contribute. We would focus on non-surveilled systems where you can deploy them on your phone. So there is so much promise if we would focus in our research on these decentralized technologies that I don't think we need to hide or anything in the future is lost. I think we have a great opportunity here in Europe to build something different.
I hope we will.
Yes.
Because we have different values, we've got different ideas on how healthcare should look like, and with that, we just reached the destination for you and your next meeting.
Oh.
So I'm just gonna say thank you.
Thank you. This is your old employer, no?
Yes, it is. It is. So
This
I know
is déjà
exactly.
vu. How do you still have a card from the parking lot?
I don't. I just,
Oh, you have a card.
No, I don't have it. So thank you, Bart.
Thank you, Tjasa. There.